We are broadcasting live from the top of the Hancock Whitney Bank building. And today I have a special guest with me, Michael Parrott with Covenant. Why do I want to say laboratory? Laboratories. Can we just call it?
Just makes it more.
Can we just call it Covenant Lab? Okay.
Covenant Lab is fine, yes, ma'am.
Michael, you just moved here to the Bay. Tell me, why did you decide to set up your business here in the Bay?
That's a great question, and it's not. Have you ever heard the adage of you can take the boy out of a small town, but you can't take the small town out of the boy? Well, I grew up in a small town, north of Louisiana, and wanted to move in the area, and I love the Gulf Coast. But there's a strategic point too, because we're reaching not just this area, but we have a focus the I-10 corridor from Texas all the way to Florida to be able to access and provide the services that we're doing.
Well, let's talk about the services that you are providing.
We are a medical diagnostic laboratory. So have you ever had your blood drawn?
Oh, yeah, every 6 months.
Every 6 months. Well, when the doctor sends that blood off and you kind of wonder where it goes and all of a sudden the results pop back up, well, that's what I do. My background is I'm a medical technologist, been running in the laboratory for nearly 3 decades. And so we've had the opportunity to bring a level of diagnostics to the Gulf Coast. Myself and several of my key leaders in the organization have large laboratory experience. So we've taken that knowledge and some more and said, let's go to the Gulf and make it better. You know, how can we offer that opportunity? So we offer a lot of diagnostic tools to help the physician.
So as an average citizen, how are you helping me and how would I use your services?
Typically, there's a couple of ways. The most common way is through your physician. So when you go to your physician, he orders, collects at the office or collect at one of our locations that we're developing. That sample will come to us and we'll manage that, and then we'll return the results back to your physician. So that's how it's going to impact you as a patient.
And I'm sure you want to work with these local businesses here, some of the larger employers. How would they tap into your services?
That is a great question. And where we're focused, of course, with the pandemic, that's where a lot of focus is. That would be a key way that we can help. Currently working with several organizations in occupational medicine COVID. Now being part of the Chamber of Commerce, we can offer any of your business leaders a way to partner, consult, provide guidance on how we can help your organization or their organization navigate this crazy pandemic. And then beyond that, with some of the systems that we're putting together, we'll talk a little bit more about the bloods that we have, or the tests that we have. Those tests for occupational, we can provide for employment screening, accident, or even wellness. A large focus today is preventive care. And that's exactly what I've developed with our organization, not only to help in the immediate diagnosis of a disease, but how do we help with preventive care? And a lot of organizations are recognizing, can we help our patients, or our employees, patients, employees, we get kind of mixed up there, but help our patients, employees again. Everybody wants a long-term career. Well, let's track the health. And we can provide, again, guidance consulting where we can help the organization develop a wellness program for their employees. And it's an added benefit. So we have a lot of different, not to go into too many details, but we can have a lot of ways to do that.
Well, I guess the test that we all know about is the COVID test.
Everybody's heard about the COVID test. If you haven't, you've been living under a rock, I guess. It's been, it has been a taxing focus on the laboratory. Laboratory medicine was not ready for the onslaught to come on, but we responded, the industry has responded extremely well. And that's what has led me to develop the laboratory and the focus that I have with the laboratory to grow and to treat or help diagnose COVID. But not only COVID, with the COVID pandemic going on right now, again, going back to what we discussed with the employees, we'll be able to help with the how can we help them avoid COVID impacting their business? Because everybody's been impacted. You know, the car industry, the computer industry, everybody's been impacted because of people are out sick. How can we prevent that?
Well, and, so many places that offer the COVID test, it takes several days for you
Yes.
to get your results.
Right.
So that's not the way it is there in
we
your
don't-
lab.
we focus on same day testing. The differentiator, people, when I talk to, what's the difference in service? My focus, very simply put, if you take care of the patient, everything else alone. And so by taking care of that patient is offering that expedient service. We live in the instant society. You push the button, you get a meal in 3 minutes. Laboratories are not that way because of all the time. There are certain tests that can. But COVID, you want to make sure because of the consequence, if you want it that way, of COVID, if you are positive for COVID, what do you do to treat that?
The last thing you want to do is wait several days to find out if you're going to test.
And so what we're doing, we picked up COVID tests in the area, and we're typically releasing it by midnight, but definitely by the next morning.
There are other tests too, like UTI,
Sure.
toxicology.
I'll walk through briefly what we offer. So there are 3 focuses that we do: blood work, toxicology, and molecular. So what I mentioned with blood work and wellness, what we focus, the way we've developed our program is to look at a function of preventive medicine. That's a real focus that I believe healthcare has today, is how we prevent the disease. And we're not just looking at what's going on right now with that blood work. We're looking at what could happen. What can we do to help prevent that and provide that information to the physician? Because that's what we do. We're here to improve how we provide that information to empower the clinician to be a champion for you, the patient. And so with the blood work is key to make sure that all your systems are working right. If they're not, how do we treat to make sure it gets back in line? Second is the toxicology. The toxicology is key to ensure compliance when you take a medication, that the patient is compliant with taking the medication, that the doctor knows that yes, it's present. How much is in the body, and if there's anything that needs to be adjusted for that physician, that clinician to treat that patient based on those results. Thirdly is our molecular area. Of course, that's COVID. The buzzword right now is RT-PCR, real-time PCR. You got to have it to go anywhere. Went to lunch yesterday, and you got to show your card. Yes, I'm good to go. But with the real-time PCR, the technology that we brought is extremely modern. It's cutting edge. And what we're able to do is test the genomic material of viruses, bacteria, fungus, a lot of different things that we can test to identify very sensitively and specifically what it is and how much is there and how do we treat it. So with the organization I've developed to ensure we have the ability for the testing in this area, the doctors have the information so they can provide that treatment they need.
And we can't wait to welcome Michael Pratt during the ribbon cutting for the Hancock Chamber on October 28th. He's going to have his whole team there. Hancock Square is where their office is located. And we invite all of you to join us on October 28th at 4 o'clock to welcome Michael and his team, not only to the Bay, but also to the Chamber of Commerce.
We're looking forward to that. We have a team that's putting the opening together. Thankfully, they don't tell me, they just tell me where to be. I'm good with that. So I don't get in the way and get into the wrong information. So we're excited about that. And we're very excited about being here in Bay St. Louis.
So, just that.
Thank you so much.